Researchers have identified brain circuits that, when injured, cause patients with acute brain injury to experience paralysis of consciousness, a phenomenon known as hidden consciousness. Columbia researchers have identified brain damage that may be the basis of latent consciousness, a puzzling phenomenon in which patients with brain damage are unable to respond to simple commands, making them seem unconscious, although to some extent conscious. Our study shows that patients with latent consciousness can hear and understand verbal commands, but cannot execute them due to damage to the brain circuits that carry commands from the brain to the muscles, said Jan Clausen, official of the study. MD, Associate Professor in Neurology at Columbia University's Vagelos College of Physicians and Surgeons and Chief of Hospital Neurology and Critical Care at New York Presbyterian/Columbia University Irving Medical Center. This finding could help doctors more quickly identify patients with latent conscious brain damage and better predict which patients are likely to recover through rehabilitation. Hidden consciousness, also known as cognitive motor dissociation, CMD, occurs in about 15 to 25% of patients with brain damage from head trauma, brain hemorrhage, or cardiac arrest. In previous work, Clausen and colleagues found that subtle brain waves detectable by an EEG were the best predictor of latent consciousness and eventual recovery in patients with unresponsive brain damage. But the exact pathway in the brain that is disrupted in this condition is unknown. In the new study, researchers used EEGs to examine 107 patients with brain damage. This technique can determine when the patient tries, though cannot, to respond to commands such as, keep opening and closing your right hand.